Okay, so our next chapter is talking about digestive and endocrine disorders. This is chapter 36. And let me see where I want to start here. Hang on here for just a second. So these digestive disorders, basically, the digestive system breaks down food for the body to absorb and eliminates solid waste. I mean, that's what our gut does. We eat it and it comes out the other end. So one of the digestive disorders, excuse me, that you're going to see is called gastroesophageal reflux disease, or GERD for short. And it's a disease in which the stomach contents flow back from the stomach into the esophagus. So they get a lot of regurgitation. Well, we have acid in our stomachs, okay? That's what breaks down, that's what is part of the food digestion process. And what happens is once that acid gets out of the stomach, it irritates and inflames the esophagus lining, causing what's called esophagitis. Um, so it's inflammation of the esophagus. So anytime you see an itis at the end, it means inflammation of something. So heartburn is the most common symptom of GERD, um, and risk factors for it include being overweight or obese, alcohol use, pregnancy, smoking, and then hiatal hernia. And a hiatal hernia, there is a tear in the diaphragm, of which is part of the lungs here that help pull the lungs down back and forth, where there's a tear in it, and part of that stomach comes through that opening, and that's where you get the hiatal hernia. um, I think, and when they do have heartburn, they also, they'll complain of burning in their chest and sometimes the throat because of that acid reflux, the acid up into the esophagus causing the inflammation. And they also get it, sometimes they'll complain of a sour taste in the back of their mouth, and that's from the regurgitation. And other symptoms of GERD is they can have chest pain, often when they're lying down, or they can be hoarse in the morning. They can have difficulty swallowing, which is called dysphagia or dysphagia. I'll put some dysphagia sometimes. So if you hear me say that, I've probably pronounced it incorrectly. Choking, they feel like they're choking, or they feel like food is stuck in their throat, or their throat feels like it's really tight, or they have this dry cough and it's sore, and they can have bad breath as well. So all these things can happen with GERD. So if you get a complaint like that, then you would report that to the nurse. Um, and how we get digestive disorders really varies depending on what's going on with the body. It can develop from any part of the digestive system, including the liver, the gallbladder, and the pancreas, which are all considered accessory organs of digestion. So let's talk about GERD a little more. Um, so that's the first one. Yeah. So causes include, we get this acid reflux when we eat a really, really large meal, or we lie down shortly after eating. Certain foods like citrus fruits, chocolate, caffeine, fried fatty foods, garlic, onions, all these have that increased acidity, and they can cause the acid reflux. And the treatment would include lifestyle changes. And when I'm talking about lifestyle changes, that would include like not smoking or not drinking alcohol or eliminating fatty and fried foods from your diet, going healthier basically, losing weight if they're overweight or obese, eating small meals instead of the large meals, wearing loose belts or loose clothing, not too tight, putting more pressure on the stomach. not lying down for about 3 hours after a meal, or raising the head of the bed up 6 to 8 inches. Might have to put a wedge under them if they're at home or something, so that if they got to lie down right after a meal, that type of thing. Also, we can give them medications to prevent stomach acid production, or we can give medications that would promote emptying of the stomach. Um, and all, and then they can have surgery if the drugs and their lifestyle changes don't work. But surgery is usually a last resort for this particular problem. And your next slide goes over the lifestyle changes that I just talked about. So we're going to skip that one because it's there for you to look at. Then vomiting. Okay, so vomiting means expelling stomach contents through the mouth, and it usually signals an illness or injury. And what you can happen is aspiration. And even you as a healthy person, if you're not careful or something happens, you can aspirate vomitus as well. And that can also obstruct the airway because it can be food. It can be, may not be finely chewed up food or something. It could be more chunky, is what I'm trying to say. But it can actually obstruct the airway. But vomitus, or it's known as emesis, is the food and fluids expelled from the stomach. That's what vomitus is. And then vomiting large amounts of blood can lead to shock. So if you had a bleeding ulcer or something, you're in serious trouble, and it needs to seek immediate attention because loss of blood can cause shock. So, when you're um, having to deal with vomit, make sure you're wearing your gloves and any type of other PPE you might need, because people can forcefully vomit, and it's called projectile vomiting because literally with the force that they use actually projects it forward and out. So, and I've had a person have projectile vomiting, and even though in the bed where it landed was at the end of the bed, because it was so forceful when she threw up. So you want to make sure you're following your standard precautions, and turn the patient's head well to one side. Remember, we don't want them lying on their back because they're going to aspirate. You need to get them lying on their side. Um, and that prevents aspiration. Of course, place a kidney basin under the person's chin, or sometimes if they're vomiting a lot, I'll give them the big bath basin to throw up in. Um, and then as soon as they're finished vomiting, you want to move that away from them, help them, give them oral hygiene, because remember, that's acid. So you don't want that acid sitting in their mouth and on their teeth. So you want to make sure you oral hygiene. And then observe the vomitus itself and see what color it is, the odor, any undigested food. It can range. Um, Dry heaves means they're vomiting, but they don't have anything to vomit up. It's just the motion of vomiting, which is mostly unpleasant. Um, you want to measure. We can also measure vomitus, so we can say how much they had. Now if they throw up on the floor or on the bed, you can't measure that. But if they throw up in the basin or the emesis or a bath basin, we can actually measure that. So you would measure and record that as part of your intake and output. You might have to save a specimen for lab. You never know. So what you do is you don't throw it out. You report it and have the nurse come back and observe it and let her make that decision as far as, if they have to have a specimen or something like that. But she needs to see it so that she can do her own documentation. And because usually, if you don't have anything for vomiting, we're going to have to call the doctor and get them something for vomiting. Um, and then, of course, you've got to eliminate the odors. So as soon as you can get them cleaned up and the room cleaned up, that will help alleviate the odors, because it won't be pleasant for you either, doing all this. And then provide comfort. Now, diverticular disease, many people have these little small pouches in their colon, and they're called diverticuli if they have more than one. And each pouch is called a diverticulum. So if you only had one, you would have a diverticulum, but if you had several, you would have diverticuli. Well, these little pouches can get inflamed, and then when they do, and or they can become infected, it's called, then it goes from diverticuli to diverticulitis. So and a ruptured pouch is severe because that's life-threatening, because now you have an opening from the gut into the abdominal cavity. So that's why it's life-threatening. So risk factors are age, low fiber diet, and constipation. So the doctors need really orders dietary changes for this patient, and try to get here. Um, some antibiotics are used if they think it's infected with a, and then sometimes surgery is needed for this disease if it's really, really bad, or they have an obstruction, or the pouch or the diverticuli rupture, one or the other. Um, and basically, you're not going to see you can hear of it, but you're not going to per se see it. But if they start complaining of abdominal problems, then for that. And that's basically all you need to know about diverticular disease. Gallstones. Bile is, let's start out with bile, because that's how we get the gallstones in that area. Bile is a greenish liquid made in the liver, and it's stored in a gallbladder until it's needed to digest fat. Okay, well, stones can build up in the gallbladder um, because this bile can harden, and they can be various sizes, but what they do cause is a lot of pain. And a lot of times they'll get stuck in the common bile duct. And then that's where the pain comes in, and the inflammation, and it can cause a lot of problems. So, what we do for gallstones, make sure I'm okay. So, the person who is at risk include women. We have more gallstones than men. Older age than 60, American Indians, Mexican Americans, overweight persons, men or women, fasting, losing weight quickly, or if they're on an estrogen replacement therapy, or cholesterol lowering medications, all increase a person's risk for risk factors. I mean, increase the risk for gallstones. Even diabetes can increase your risk. So, uh, for um, when the bowel is trapped, it causes inflammation, and that's the problem here, and pain. And the pain can be excruciating for the person, depending if they have a flare up. Um, because if it can't get out, if the bowel can't get out, it backs up, and not only can you not process the fats that you just ate, but then you have problems with the backflow. So the liver and pancreas can become involved. Um, and if they get a really severe infection, they can actually die from gallstones. So, it's kind of serious. So if you've got a family history of gallstones, or your diet is high in fat and cholesterol and low in fiber, all of those increase the risk. So that's why he orders those dietary changes. A lot of the times he's going to encourage a person to um, to eat better, especially anything that would have to do with your the fat content you take in. So, what do we do when they have an attack? Because they get what's called a gallbladder attack, and it occurs suddenly or following a fatty meal. Now, I've had a gallbladder attack, and they are no fun. When I had mine, it was kind of characteristic. It occurred after a fatty meal, and it was like they would describe it as like someone who stuck a knife in the middle of your back and twist knife, and it does really. It feels really sharp, and it's in that um, area. So when they start really complaining of pain after a meal, that's what you need to report, and then it's the doctor's It's the nurse's responsibility to notify the doctor and the doctor's responsibility to investigate the problem. And the most common treatment is surgical removal of the gallbladder. So hepatitis is another thing that you could come across, and we all try to protect ourselves from hepatitis because these are bloodborne. Most of these are bloodborne um, diseases. Not all of them. Hepatitis A isn't bloodborne, but B and C are. So there's 5 major types of hepatitis: A, B, C, D, and E. So you would follow your standard precautions or your bloodborne pathogen standard, or if they're in an isolation precaution, you would follow that. And basically, you're just going to assist the person with hygiene and hand washing as needed. So let's talk about each different hepatitis. Hepatitis A is spread by food or water contaminated with feces from an infected person. So, say if you're out on the river, say you like to go boating, you go out on the river and you're skiing or something, and you take in a gulp of river water at some point in your life, or in a pond or in a lake, you can contract hepatitis A via this way because you're ingesting contaminated water or possible contaminated water. Um, And so a lot of times we don't have a lot of problems with hepatitis A, but I can remember back when I first learned about hepatitis A. I remember back when I was a kid, I'm thinking, I probably had it when I was a kid and didn't even know it. Um, but basically, for right now, since you know it's conveyed via food or water through feces, you would want to make sure you handle your bedpans, feces, and rectal thermometers carefully. Okay, and hand washing, hand washing, and hand washing can never be stressed enough for any of these. Now, hepatitis B or HB is spread through infected blood or blood products or body fluids, blood that's in body fluids like saliva, semen, vaginal secretions of infected persons. And they can also be spread by IV use, accidental needle sticks, sex without a condom, especially anal sex, and then contaminated tools used for tattoos or body piercings, and even sharing a toothbrush, razor, or nail clippers with an infected person. So that's why your mama said don't share your toothbrush with anybody. Also, that's why each person in the nursing facility should have their own clippers. They usually have their own little clippers to clip their fingernails so that we don't spread any type of bloodborne pathogen. Hepatitis C is spread by blood contaminated with the hepatitis C virus, and that person may not even have any symptoms, but it actually causes some serious liver disease and damage, and it can actually show up years later. It doesn't have to be immediate. So that's why we, again, IV drug use, sharing needles, blood contaminated with the virus, inhaling cocaine through contaminated straws, contaminated tools, whether used for tattoos or body piercings, high risk sexual activity, sharing toothbrush, razor, and nail clippers again because it's bloodborne transmission. Hepatitis D and E really only occur with people who are infected with hepatitis B, and it's spread the same way, so through blood. Hepatitis E is spread through food or water contaminated by feces from an infected person. So it's the fecal oral route, basically. But they're not common. These aren't common in the United States, but A, B, and C are. Okay. So let me see. There, each of your slot, I think, let me go through here. Yeah. Talk about A and B here. I'm ahead of myself here. Um, we can treat chronic hepatitis B with some medicines, But again, it's not curable. We're just treating it. We're just controlling symptoms. Um, let's go on with that one. Okay, make sure I got you each of those that I needed, things I need you to know. Now, cirrhosis, it's a liver condition caused by chronic damage to the liver. And what happens is this scar tissue is replacing the healthy tissue that's been damaged. So blood flow through the liver is blocked. And then that affects the normal liver functions. And our livers do a lot for us. They help control infection, they help remove bacteria and toxins from the blood, they process nutrients, hormones, and drugs, they make proteins for blood clotting, and they use bowel for fat digestion. So our livers are really super important. And we really just need to, drinking too much alcohol can cause liver changes. If you're exposed to hepatitis B or C, that can cause liver damage and obesity. So, want to be really careful about um, these types of things. But as far as caring for a person with cirrhosis, um, observe for any vomiting, observe their stools for blood, anything that you would see, especially their mental function changes, because when really bad liver disease, we get it can't break down ammonia, and that'll go to your brain and make you very, very confused. So anytime you have a behavioral change, a mental change, you should immediately report that um, to the nurse. Uh, Sometimes they have to be weighed daily, and they get what's called an ascites, which is a fluid buildup on over the in the abdomen. So sometimes their abdomens will look really large, and they won't look normal. I'll just put it that way. But basically, we would have to provide good skin care. We might be weighing them daily. Um, you still again have to provide oral hygiene and assist with their ADLs, whatever they need. So complications, like I told you, that fluid in the abdomen is called ascites, and edema, which means swelling. They can look yellow their skin color can become yellow, and that's called jaundice. They are easily have infections, and they bruise and easily, as well as they can bleed easily. So because remember, our liver uh, makes important things for our blood clotting system. So blood vessels in the esophagus and stomach may enlarge and burst, and this is life-threatening if that was to occur. Again, confusion, personality changes, those are big because of this toxin buildup in the brain. So treatment's basically aimed at preventing the tissue progress, and so that would be antibiotics, avoidance of alcohol, meds and enemas to remove the toxins, a healthy diet, salt for the edema. And then, of course, if it's all else fails, you can be put on the liver transplant list. So, endocrine system. Diabetes is the most common endocrine disorder. So you see a lot of persons with diabetes. Based body can't produce or use insulin properly. Without insulin, sugar builds up in the blood because it can't get into the cell. The insulin is the key. So without it, the sugar can't get in. So if you have a family history of the disease we have type 1 diabetes are persons have, who never have, who never make the insulin rather, okay? These, most of them are juvenile, doesn't, because it happens when they're young, okay? Uh, Whites are at greater risk than non-whites as far as ethnic groups, but type 2 is more common in the elderly and in overweight persons. And in type 2 diabetes, you have some insulin, or you're what we call insulin resistant. And it doesn't mean you don't make insulin. In type 1s, they don't make any insulin. But in type 2, they make some insulin. It just isn't working properly. So lack of exercise and hypertension are risk factors. And then it gives you the ethnics here that are at higher risk. Um, so we have two types, and it occurs here. It again explains it here for you what type 1 is and type 2. Um, just remember, type 2 we get when we're older. So the signs and symptoms of diabetes, they're very thirsty and they go to the bathroom all the time. They feel hungry, they're always hungry, and they feel tired at the same time. They're hungry because their body wants the sugar. The cells need the sugar to live, okay? But the sugar can't get into the cells because their insulin isn't working properly or they don't have any. And then they feel really tired because you don't have any energy because we need to make energy. And then they're losing weight without trying, or they have sores that heal slowly, and their skin can be dry and itchy, and they can have tingling and loss of feeling in the feet because then it's affecting the nerves, and they can have blurred vision. And a lot of times, um, it's discovered with vision because the vessels in your eyes are very, very delicate and they're very easily affected by high blood sugar. So the complications include all these things listed on here, okay? The main thing you need to know is that, the blood glucose could be monitored daily 3 or 4 times a day, which makes their fingers sore sometimes. I mean, it'll get calloused over a while, but nobody likes their fingers to be stuck 4 and 5 times a day. I'm just telling you. So, you might have to do some special care with the hands, lotion them up, be a little gentle when you're washing or having them wash their hands, that type of thing. As far as quality of life, just you want to respect the person's privacy and confidentiality, and just follow your standard precautions. And in these areas, again, hand washing is at most, and protecting yourself, but protecting the patient too. And this ends this chapter.